everyone, welcome back. Ready for another deep dive. The materials you sent over this time about this respiratory lobectomy, honestly, they're pretty fascinating.
Yeah, it's amazing what you can learn about someone's health just from one procedure.
Seriously. We're going to be talking about lungs, obviously, and
Yeah.
surgery and even cancer treatment,
Uh-huh.
all connected by this one procedure.
That's right.
So let's jump right in, I guess. Your notes mention this patient who had a left upper lobectomy.
Right.
Can you even just start with, like, what exactly does that even mean?
Sure. A lobectomy basically means that surgeons removed a lobe of the lung, not the whole lung, just a section.
Oh, okay. So, like, if the lung is a grapefruit, they took out one of the segments.
Yeah, you got it.
Got it. And in this case, it was the left upper lobe they took out.
Uh-huh.
But how can you even tell that just by looking at someone?
Well, the material you provided talks about a lateral thoracotomy scar.
Right.
That's like the classic sign that someone has had chest surgery.
Yeah.
And there's probably a smaller scar, too, from a drain that they would have used after the surgery.
Mm-hmm.
But here's the really interesting part. This patient's trachea, their windpipe, was deviated to the left. It was like a little bit off center.
Oh, wow. That's so interesting. Why would the trachea, like, shift after a lobectomy?
So think about it this way.
Mm.
Your lungs are always trying to fill up all the space that's available to them.
Mm-hmm.
When you take out a whole lobe, the rest of the lung tissue on that side has got to, like, expand to compensate, right?
Oh, I see. So it's like a balloon inflating.
Yeah, exactly. And all that pressure it pushes on everything around it, including the windpipe.
So the remaining lung tissue is like, I gotta fill this space.
Exactly.
That's pretty wild. But the materials also mentioned other things that could cause a thoracotomy scar, like a wedge resection or even a biopsy.
Oh, yeah, for sure. The thoracotomy scar doesn't always automatically mean lobectomy.
Right.
It's got to be like, all the clues together,
Like the whole picture. Yeah. So in this case, it sounds like that tracheal deviation plus the other signs were enough to point to lobectomy.
Yeah, that's right.
So, okay, we've got this patient who had part of their lung removed, which, I mean, that sounds like a pretty big deal.
Definitely.
Is this something that happens a lot? Like, what would even cause someone to need a lobectomy in the first place?
That is a great question.
Yeah.
It leads us to a pretty important topic.
Okay.
Lung cancer. A lot of times when someone's had a lobectomy, it's because they were diagnosed with lung cancer.
Yeah.
Specifically, there's this type called non-small cell lung cancer.
Okay, so lung cancer, but specifically non-small cell. Why not just all lung cancer?
Well, there's another category called small cell lung cancer, but it's usually way more aggressive,
Okay.
and it tends to spread much faster.
Oh, okay.
So by the time it's diagnosed, surgery usually isn't really a good option.
Makes sense.
Non-small cell lung cancer, on the other hand, it grows more slowly sometimes, and if it's caught early enough,
Yeah.
surgery can be an option.
So with non-small cell, there's a chance to, like, catch it before it spreads too far, and that's where lobectomy comes in.
You got it.
Got it. So non-small cell lung cancer, what does that even look like? Are there, like, different types?
Yeah, so there are actually a couple different types even within non-small cell.
Mm-hmm.
The two most common are squamous cell carcinoma.
Okay.
That one is usually linked to smoking,
Got it.
and then adenocarcinoma,
Okay.
which you can see in smokers and non-smokers.
Interesting.
And then the materials you sent, they mentioned a few less common types too, like large cell cancers and neuroendocrine tumors.
Wow. So many different
It's
kinds.
pretty complex.
So we've talked about lobectomy, which again is taking out part of the lung.
Uh-huh.
But I know there's also something called a pneumonectomy, right?
Right, pneumonectomy.
What's the difference?
So pneumonectomy is a much bigger procedure where they take out the entire lung.
Whoa, the whole thing.
The whole thing.
Yeah.
And that difference in like how much of the lung is removed, it makes a huge difference in what doctors see after surgery, especially in those first few days.
So, like, the bigger the surgery, the more noticeable the changes.
Exactly.
Makes sense.
Your material actually includes a table that compares the early signs you see after lobectomy versus pneumonectomy.
Wow, interesting.
So like after a lobectomy, that tracheal deviation we were talking about, it might actually correct itself over time.
Oh, wow.
As that remaining lung tissue expands, it'll kind of pull everything back into place.
So it's like the windpipe could eventually go back to its normal position.
Right.
That's wild.
But after a pneumonectomy, where the whole lung is gone, you would see totally different things.
Okay.
For example, the chest wall on that side, it wouldn't expand as much. And if a doctor listened to the chest with a stethoscope, they wouldn't hear any breath sounds on that side at all.
Oh, wow.
Yeah,
So those early signs can tell you a lot about which surgery someone had.
exactly.
Yeah.
It's all about understanding how the body changes after surgery,
Hmm.
whether it's lobectomy or pneumonectomy.
So if someone's diagnosed with, what was it, early stage non-small cell lung cancer,
Yeah.
does that automatically mean they'll need surgery? Like, is that the standard?
That's a good question. And the answer is no. Not everyone with early stage non-small cell lung cancer ends up having surgery.
Yeah.
It's not an easy decision. There are a lot of factors that come into play.
Like what?
Well, you got to think about the patient's personal preferences,
Yeah.
right?
Yeah.
And their overall health.
Mm-hmm.
And of course, the expertise of like a whole team of doctors.
So it's not just one doctor saying, okay, surgery.
No, not at all.
It's like a whole team.
It's called a multidisciplinary
Right.
team,
Multidisciplinary.
or MDT.
Yeah.
To consider everything: the patient's age, their medical history,
Yeah.
all the little details about the cancer itself.
Okay.
And one of the key things they look at is the patient's lung function.
Makes sense.
They want to make sure those lungs are strong enough to handle the surgery and that they'll still work properly afterwards.
But how do they even measure lung function? Is there a specific test for that?
There absolutely is. It's called spirometry.
Spirometry.
You ever blow out candles on a birthday cake?
Yeah.
It's kind of like that, but with a fancy machine.
Oh, okay.
It basically measures how much air you can forcefully exhale in 1 second.
Mm-hmm.
And that measurement is called FEV1.
Mm-hmm.
And your sources, they talk about how this FEV1 number is super important in figuring out if someone can handle surgery.
So it's like, is your breathing strong enough?
Uh-huh. It's like a gatekeeper, making sure your lungs are up to the task.
So are there like specific FEV1 numbers that determine if someone is good for a lobectomy or a pneumonectomy?
Totally. The material you sent over mentions that for lobectomy, the FEV1 needs to be greater than 1.5 liters.
Okay.
And for pneumonectomy, it's got to be even higher, greater than 2 liters.
Wow.
And if someone's lung function is below that threshold, surgery might be too risky.
Got it. So it's not just about removing the cancer, it's also about making sure you can still breathe afterwards.
Absolutely. It's all connected.
But what if someone's FEV1 is high enough? Does that mean they're good to go for surgery?
Not necessarily. There's another test they often do called cardiopulmonary exercise testing,
Okay.
or CPET. It looks at how well the heart and lungs work together during exercise. So
So it's like a more real-world test.
yeah, it's more comprehensive.
Yeah.
It gives a better idea of if you're actually fit for surgery.
Wow, so many different tests. So let's say someone goes to the doctor and there's like a suspicion of lung cancer.
Right.
What happens next? How do they actually go about like diagnosing it?
So usually the first step is doing a CT scan.
Right.
That gives them a really detailed image of the lungs.
Okay.
And if they see anything suspicious in the scan, like a mass or a nodule,
Mm-hmm.
the next step is crucial.
Mm-hmm.
They have to get a tissue diagnosis.
So you can't just rely on the image. You have to look at the cells.
Exactly.
Yeah.
They need to look at those cells under a microscope to know for sure if it's cancer.
Yeah.
And if it is cancer, what type it is.
So like just because there's a suspicious spot doesn't necessarily mean cancer. They got to actually look at the cells.
All right, exactly.
Okay, so how do they get that tissue sample?
There are a few different ways. One way is they might do a bronchoscopy.
Okay.
They basically thread this thin tube with a camera down into the lungs.
Hmm.
Or they could do a radiologically guided biopsy
Right.
where they use imaging to guide a needle to the suspicious spot and take a sample.
And your materials mention both of these procedures.
Yep.
But what about the lymph nodes? Cancer can spread to those, right?
Absolutely. That's a really important point.
So do they check those too?
Oh, yeah, for sure. If there's any worry that the cancer might have spread to those lymph nodes, they'll do a biopsy on those too.
Okay.
They want to know exactly where the cancer is and how far it might have spread.
Mm-hmm. Isn't that called staging?
Yep, staging. That's exactly what it is.
Like figuring out how advanced it is?
Uh-huh.
Okay, so staging is crucial because it helps determine the treatment.
That's right.
Okay, so they're using all these tools, imaging, biopsies, to get this complete picture. It's like putting a puzzle together.
Yeah, exactly.
So do they use anything else for diagnosis?
Well, for early stage cancers,
Mm-hmm.
where there's a real chance of a cure,
Mm-hmm.
they often use a special type of scan called a PTCT.
Okay.
It really helps pinpoint exactly where the cancer is and if it's spread anywhere else.
So it's like getting as much information as possible before deciding on treatment.
Exactly. It's all about having the full picture so they can make the best decisions for each patient.
It's amazing how much we've uncovered just from these materials.
Right. We went from a scar to a deep dive into lung cancer diagnosis.
Seriously.
Yeah,
It's incredible how much we can learn just from a few clues.
it is, isn't it?
And we've only just scratched the surface of what we can learn about lung cancer.
I think that's a great place to stop for today.
Yeah, we've given everyone a lot to think about already.
We'll pick up the conversation next time, all right?
Sounds good. See you then.
See ya.
So it's incredible all the information doctors can pull together just to figure out what's going on inside the body.
It really is.
Like, they're basically medical detectives
Hmm.
putting together this complex puzzle using tests and what they can observe.
It's amazing how far medical science has come.
Right. And speaking of treatment, we've been focusing on lobectomy as an option for lung cancer.
Yeah.
But obviously, that's not the only tool in the toolbox, right?
You're right. Surgery is just one piece of the puzzle,
Hmm.
depending on the type and stage of the lung cancer. Other treatment options might be a better choice.
Okay, so what are some of those other options besides surgery? I mean,
Well, there's chemotherapy.
right?
It uses drugs to kill cancer cells.
Hmm.
And then there's radiation therapy,
Okay.
which uses high-energy rays to target the cancer cells.
Okay, so chemo and radiation. Those are the ones I've definitely heard of.
Yeah.
But are there any, like, newer approaches for treating lung cancer? Like anything more cutting edge?
Oh, yeah, for sure.
Like what?
In recent years, there have been some really cool advances in targeted therapy and immunotherapy.
Okay, so targeted therapy.
Uh-huh.
What is that?
So targeted therapy uses drugs that zero in on specific molecules or pathways
Okay.
that are involved in how the cancer grows.
So it's like more precise.
Yeah, exactly. It's like a guided missile going straight for the cancer cells.
Wow. And doing less damage to healthy cells.
That's the goal. Minimize the damage to the healthy cells while taking out the cancer.
That's incredible. Okay, what about immunotherapy?
So immunotherapy is super interesting. It basically uses your own immune system to fight the cancer.
Oh, wow.
It's like giving your immune system a boost
Okay.
so it can recognize and attack the cancer cells better.
So many different options. It's kind of overwhelming, honestly.
It is.
With all these different approaches, how do doctors even choose the best one for each patient?
It's a complex decision for sure. It's not a one-size-fits-all approach.
So, what are some of the things they take into account when making that decision?
Well, like we said before, the type and stage of the cancer is super important.
Mm-hmm.
But they also look at the patient's overall health, how old they are,
Yeah.
other medical conditions they might have,
Okay.
and of course, the patient's own preferences matter a lot too.
Right, because it's not just about the medical stuff, it's about what the patient is comfortable with.
Absolutely. It's very personal.
So that's where the multidisciplinary team comes in.
Exactly. The MDT brings together all these different specialists,
Okay.
surgeons, oncologists, radiologists, pathologists, nurses.
Sure, many.
They all come together to make a personalized treatment plan for each person.
So it's really a team effort to figure out the best approach.
Yep, exactly.
That's really reassuring, honestly, knowing that there are so many experts working together.
Yeah, they can really put their heads together and come up with the best possible plan.
And they're also there to support the patient, right?
Absolutely. It's not just about the medical expertise. It's
Yeah.
about being there for the patient,
Yeah.
answering their questions,
Mm-hmm.
helping them navigate all the challenges of lung cancer treatment.
Because I imagine being diagnosed with lung cancer, that's got to be so overwhelming.
Oh, absolutely. It's a huge life change, and there's a lot of fear and anxiety that comes with it.
So it's important to have that support system in place.
Absolutely.
Yeah.
Family and friends are so important during this time.
Yeah,
And there are also support groups, both online and in person,
that's great.
where people can connect with others who are going through the same thing.
It's nice to know that there's so much support available, even beyond the medical team.
It really makes a difference knowing you're not alone.
It does. And is there hope with lung cancer? I mean, with all the challenges?
There is. I think that's really important to emphasize.
Right.
Lung cancer treatment has come a long way,
Mm-hmm.
and there are a lot of reasons to be optimistic.
Okay, like what?
Well, survival rates are getting better all the time.
That's great.
New treatments are being developed,
Mhm.
and there's a lot of research going on.
That's really good to hear. It's important to focus on the positive.
Yeah, absolutely.
Okay, so we've been talking about lobectomy and lung cancer in very technical terms.
Yeah.
But it's important to remember the human side of this too, right?
Absolutely. Behind every diagnosis, every treatment,
Yeah.
there's a person.
A person with their own story, their own fears and hopes.
Exactly.
So as we continue to go through these materials, we'll keep that human element in mind.
Absolutely. It's not just about the science, it's about people.
People whose lives are affected by this disease.
Yeah.
So let's keep going and see what else we can uncover.
Sounds good to me.
You know, it's really amazing how much we've learned in this deep dive into lobectomy. We started with what seemed like a simple surgery, but it's led us to this, like, much broader conversation about lungs and cancer and the whole process of diagnosis and treatment. What's been, like, the biggest takeaway for you?
I think for me, what really stands out is how this whole deep dive highlights the idea of personalized medicine. You know,
Oh, yeah, totally.
it's not just about treating a disease, it's about treating a person.
Right.
And that means taking into account all the unique factors that make each person different.
Like their medical history.
Exactly. Their medical history, their lifestyle,
Mm-hmm.
their values,
Right.
even their support system.
Yeah, it's about tailoring the approach to each person, not just applying a one-size-fits-all.
Exactly.
And that goes back to what we've been saying all along, right? It's
Yeah.
not just about the science, it's about people.
Absolutely.
And speaking of people, one thing that really resonated with me was the idea of that multidisciplinary team.
Mm-hmm.
It's so reassuring knowing that when someone is facing something as serious as lung cancer, they have this whole team of experts behind them.
Right. All working together to give the best possible care.
And it's not just about the medical stuff either.
Oh, for sure.
The MDT is also there to answer questions,
Uh-huh.
provide support, absolutely, and just guide the patient through what must be a very scary time.
It makes a world of difference having that kind of support.
So we've gone over lobectomy,
Mm-hmm.
lung cancer,
Yeah.
all the different ways to diagnose it, treatment options.
Yeah.
That multidisciplinary team approach.
That's a lot.
We've covered a lot of ground, but I bet this is just the start of your exploration into this, right?
Probably. It always sparks more questions, doesn't it?
Oh, for sure. So what are you wondering about now? The long-term effects of lobectomy?
Maybe.
The latest research on lung cancer?
Could be.
Or even just like how lifestyle choices affect lung health?
All important questions.
So whatever questions this deep dive has raised for you, keep learning, keep digging.
Absolutely. Knowledge is power.
Right. The more you know, the better you can advocate for your own health.
Exactly.
Hmm.
So don't be afraid to ask your doctor questions.
Mm-hmm.
Do your own research. Find reliable sources.
Yeah.
Connect with other people who are going through the same thing.
There's a lot of information out there, and there are people who want to help. We've given you a lot to think about today and a good foundation to keep exploring these topics. But before we go, I want to leave you with one last thought. We've focused a lot on the physical side of things, lobectomy, lung cancer, but these materials also touched on the emotional and psychological impact of this disease.
Oh, yeah, definitely.
Like, how do people cope with the fear and anxiety that comes with a diagnosis like this? What role does mental health play in the healing process? Those are some big questions.
Important questions.
So keep those in mind as you continue learning and exploring. The human experience of illness is complex, and it's important to consider all those aspects.
Well said.
So keep those questions coming. We'll be here for your next deep dive whenever you're ready.
See you then.